Try to see how it works.
All right, good evening, everyone. Want to call the Health Board to order this evening for the August 1st, 2024 meeting. I'd like to welcome everyone who's here in our audience, as well as those who are watching us online by TV or whatever means and medium that you are viewing us this evening. So we do want to say a welcome. I don't think we have anyone signed up for public comment this evening. So Dr. Davis is going to lead us in our invocation, and he's also going to lead us in our Pledge of Allegiance following our invocation. So if you would.
My turn.
Does he get extra pay for doing both?
He does.
Absolutely. Would you bow your heads with me, please? Almighty and awesome God, we thank you for helping to get 2 American patriots released from the hands of the brutal Russian dictator Vladimir Putin today. We also gratefully acknowledge our dedicated staff members here in the health department who selflessly serve our citizens and the other people in our communities. Please guide us and help us to give more guidance and help and serve the community so that we may make it a healthy and safe place to live and work as we go forward. For all these things we ask in Jesus' name, amen.
Amen.
Would you face the flag with me, please? Today I'd like to recognize 2 selfless patriots who were released from Russia, Paul Whelan, Evan Gerskovich, who sacrificed for our country and our nation and supported our flag and our nation. For nearly 250 years now, our ancestors have faithfully saluted and defended this flag of our nation, and I hope that you will join me in proudly saluting the flag by saying the Pledge of Allegiance with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Thank you, Dr. Davis. That brings us to our announcements this evening, and our health director, Ms. Anna Cook. You got any announcements?
I've got just a few. I wanted to welcome our new board members, Reuben Chandler, he's our engineer, and then Karen Cannon, she's our pharmacist, so just welcome to our board. And then we had an immunization fair on Tuesday. I believe Chelsea might talk just a little bit about that. It was good, open to the public. We really wanted to encourage kids to come and get their vaccines before school starts. One last thing, just wanted to throw out there that COVID is back. Never really went away, but we've been seeing an increase in our COVID numbers, especially within our county government. So just to keep your eyes and ears open and take precautions as needed.
All right. So with that, that brings us to our approval of the agenda. Do we have any agenda amendments this evening? And so hearing no amendments, what's a pleasure of the board in adopting our agenda this evening?
Make a motion, we approve the agenda. Second.
All right. Any other discussion or comment? All in favor say aye.
Aye.
Any opposed? And that motion carries. And the first item of business then is our oath of office to some of our remaining reinstated board members. I'll get it out in a minute. I'm having a rough time this season.
I'm good.
But our Honorable Wayne Rash has already taken his oath today. He did that in the Register of Deeds office, so he could be here tonight and administer our oath to returning board member Sandra James. And then we've got new board members Karen Cannon and Reuben Chandler. And again, we appreciate them and your willingness to be able to serve on the Board of Health with us. And they're filling specific roles. Many people don't realize, but our board is mandated by the state to have a diverse group of folks that represent the Board of Health. And one of the positions is an engineer to have on our board. And Reuben has graciously accepted that to be here in that role. And then Karen is here as our pharmacist, which is another one of those positions that we are mandated in a sense to have or try to have on this board. So with our nurses and medical doctors and our honorable Register of Deeds, I feel a little bit under, because everybody here is some professional, right? I'm just a
You are too?
politician. I'm just a politician.
What does that make me?
So at this time, we're going to ask Wayne if he can, I think, move everybody over there to do their oaths. And, so we'll be doing that down front. Yep.
Will join me down here.
You gonna do them all at once?
I think so.
Okay.
Just for this.
We have enough Bibles?
We have two here, they can hopefully join if you.
Okay,
You
yeah.
guys will hold in your left hand and raise your right. And I'm going to read the oath, and I'm going to stop at about 3 different places and ask if you do, and if so, just say, I do. It's very simple, okay? Do you solemnly swear that you will support the Constitution of the United States, so help you God?
I do.
Okay. Do you further solemnly and sincerely swear that you will be faithful and bear true allegiance to the state of North Carolina and to the constitutional powers and authorities which are or may be established for the government thereof, and that you will endeavor to support, maintain, and defend the Constitution of said state, not inconsistent with the Constitution of the United States, to the best of your knowledge and ability, so help you God?
I do.
Do you further swear that you will well and truly execute the duties of the office as a member of the Caldwell County Board of Health according to law, so help you God?
I do.
Congratulations. Easy enough. Thanks so much. Yep. Thank you.
All right, let's give a round of applause. All right. So again, we appreciate your willingness to serve and look forward to serving many years on the Board of Health. So, but we do thank you for that. That brings us then to our annual election of officers. And since we got 3 new members here, or 3, a returning member and two new ones, we do this every year in our election of our chair and vice chair. And certainly want to give anybody an opportunity that wants to serve in that role, but we typically throw this over to our health director and let her take nominations and run this portion of the meeting. So, Miss Anna Cook, you take it away.
All right, we want to open the floor to Board of Health's chair.
Just because I love him so much. Is he taking a swing at me yet? Not yet. Okay.
Not yet.
I would like to nominate our current chair, Randy Church, to continue to serve another year in that capacity.
All right, any other
I would
nominations?
second that.
Great. Any other nominations?
Madam Health Director, I move that the nominations be closed and we elect Mr. Church by acclamation.
Okay, all those in favor, say aye.
Aye.
Any opposed? Congratulations.
Oh, thank you. It's always a running opportunity to get Mr. Rash and his abilities of being able to move to chair one day, but he always skirts by that one for me. So with that, then we'll open the nominations for vice chair. And I'd like to make a motion that Wayne Rash continue serving in that role. Is there any other nominations?
I'll second that.
All right. With that, I'll move that nominations be closed, and by acclamation that Wayne Rash continue serving for another year as the vice chair of the Caldwell County Board of Health. All in favor say aye.
Aye.
Amen. And Anna, we need a larger mouth.
Will do.
All right. So we again appreciate the opportunity to serve, and thank everyone for their participation. And so that moves then to our approval of the minutes, our June 6th meeting that was held. I trust you had an opportunity to review those and ask if there's any amendments that need to be made, and if not, do I hear approval that we accept the minutes?
I'll make a motion, we accept the minutes as written.
And I'll second that.
All right. Any other discussion or comment? All in favor say aye. Aye. Any opposed? And that motion carries as well. And now it brings us to our financial reports, and Brittany Raby is coming. She's going to have an update and any revisions that she may need us to look over.
There's several this month, so.
Yeah, there is.
So this is for a month ending in June. We have elapsed 91% of our budget, and, 81% of the budget. And then we have collected in 68% of our revenue as far as for the month ending in June. We still will have one more month for that 13th month, so you'll see another budget summary once we get that. We did have several revisions. Several of our COVID grants are still kind of gradually coming through, those ones that are rolling over. But one of those, it's not COVID grant, but the health department received a private payment of $13,500 from Upstream. And this payment may be used to enhance the clinical services and important milestones set forth by Upstream. So our clinic has been receiving money if they meet certain benchmarks, and they've done a fantastic job of doing that. So we've been able to receive incentive money for that. So we received $13,500, and we can receive up to $25,000. So the next one is our ARPA Public Health Service Grant. So that was in the amount of $100,000, and that is to enhance the abilities of the health department to deliver the essential services and core functions of public health, to address the specific needs or health status indicators selected by the health department. And again, there are a lot of stipulations of these grants, so that's kind of what we ran into last time of not being able to spend the money because we were so restricted on what we could spend the money on. So we're trying to do a better job of what we can spend it on and getting ideas and things like that. So 719 was our Bridge Access Program for COVID-19 vaccines. So that one was a rollover from last time. It was $73,546, what was initially budgeted. And that's to purchase vaccine access for those that are uninsured and underinsured adults through the Bridge Access Program. And then 546, that's another CD Pandemic Recovery Grant in the amount of $61,028. And that's to expand communicable disease surveillance, detection, control, and prevention activities to address COVID-19 and other communicable disease challenges impacted by the pandemic. And then I think you guys have this on the 716, the vaccination program. Again, this was a rollover from what we had last year, and so that was in the amount of $322,532. And these will be added back into our budget once it's been approved.
All right. So here in the recommendation of approval of these budget revisions, do I hear a motion that we approve them?
So moved.
And a second?
Second.
All right. Any other discussion or comment about that? Quite a bit of rollover, so I'm sure we'll spend it somewhere. So, all right.
Thank you.
Well, all in favor say aye.
Aye.
Any opposed? And that motion carries as well. And that brings us to our public health updates this evening. Food and lodging update, Logan Little. You're up, Logan. Uh-oh. You brought reinforcements?
I just wanted to introduce you guys to both of our food and lodging staff. Logan Little, you're aware of, and Jake Johnson is our new one.
Okay.
Excellent crew I've got working.
Let me say, I appreciate new employees getting to come and us be able to see and meet them. I've asked for that at the commission level, and I'm told as a commissioner, at the commissioner meetings, that we just can't do that, because all these people are busy. So thank you for coming tonight, and it's good to be able to put a face with a name. I've seen Logan a few times out eating. I'd be out eating somewhere, and you come in, and I noticed the staff really gets busy when they see you walk in.
So we should invite you to dinner.
Yeah.
But it's great to actually come out and meet y'all tonight. So what we're going to be presenting to you are our annual compliance totals. So just to give you a little bit of background, based on the number of inspections we complete each year, we get grant money from the state. So that's what we'll be showing to y'all tonight. Let's see. So just to give you a little bit of background on Jake and myself, I started with Caldwell County Environmental Health June 10th, 2019. So I've been here for a couple of years. And Jake started, he's coming up on his year soon. He started September 1st. I have a Bachelor's of Science from Appalachian State University, and he has a Bachelor's of Science in Public Health from Brigham Young University. So we're just going to jump right into our numbers here. For the 23-24 fiscal year, we were able to achieve 56%, which is a significant improvement over our last few years. Just to throw it out there, once Jake finally got authorized and we were both running full-time doing restaurant inspections, our last quarter, we were able to get close to 100%. We got 87% for that final quarter. So hopefully for the 24-25 fiscal year, we're going to be even closer to our 100% goal. About the compliance totals themselves, so we have 279 facilities here in the county that count towards those totals. So that would be our restaurants, food stands, push carts, mobile food units, hospitals, hotels, motels, summer camps, nursing homes, group homes, and the one hospital that we have. So annually, that comes to about 789 inspections. So for the fiscal year of 23-24, we were able to complete 412 of those inspections. And just to give you a little bit of background, so those compliance totals really only factor in 1/4 of our total duties that we do in the food and lodging program. So in addition to those food, lodging, and institution establishments, we also inspect child care centers and school buildings. We permit all the tattoo artists here in the county. And we're going to have a big event coming up at the end of this month. I'm really excited for that. We have anywhere from 50 to 60 artists come in town for the weekend, Labor Day weekend. So that's kind of like our Super Bowl in food and lodging. It's all hands on deck that day. And then we also do public swimming pools. So all of your parks, like Redwood Park, Granite Falls Rec Center, all these public swimming pools, we're out there permitting them and inspecting them as well. The last thing I wanted to introduce to you tonight is our online inspection portal. So as you know, all those inspection reports are public record, and we have a portal on our website now where anyone from the public can view those. Just to get there, you go to the Caldwell County NC.org webpage, and then under government, you navigate to environmental health, and then under the food and lodging tab, there's a big square box right at the top of the screen. Once you get there, you can't miss it. You click on that, and it'll take you straight to that inspection portal, and you can type in your favorite restaurant and see all the fun stuff that we get to see there. So that's really all that we've got for today. Do y'all have any questions for us?
I know I was just thinking about a couple things, but I know the school system as one example, but you guys are mandated to check their food at least. It's not just one time a year and let it go, is it?
Yes. That's
It
correct.
is?
No, we're there for at least 4 times.
That's what I was
So-
thinking, that the state mandated that it's checked like 4 times in
Yeah.
a school year.
Correct. That's absolutely right.
Yeah.
There's been some recent legislative changes, so across the board, what we consider highly susceptible population establishments, like our nursing homes and school cafeterias, those are categorized as Category 4. restaurants, which meant in the past, we would inspect them 4 times a year. With the recent legislative changes, that was last October or November, they passed the Regulatory Reform Act, which reduced all of the Category 4 establishments to be inspected 3 times a year,
Yeah.
with the addition of an educational visit. So we're still in those facilities at least 4 times a year.
Right.
For school buildings, we're in there even more than that, because we've got the pre-Ks and we've got the buildings themselves.
Yeah. So I'll just say all that to say they're very busy.
Yeah, we
And,
stay covered up. We're running pretty much from 8 a.m. to 5. And sometimes even after that, because we also, let's say like the recent Blackberry Festival, all of our food vendors there, we're out there permitting all those to make sure that they're safe for the public for the event.
Yeah, you guys did a great job with that. I know my staff was like, we want to go eat. And then they were told they couldn't yet because you guys hadn't
Yeah.
inspected. So that's awesome.
Yeah,
You guys do a great
absolutely.
job of making sure everybody stays safe. Restaurants, how often do you guys have to inspect just a typical restaurant in the county?
So it depends on the kind of establishment. So like our big places like Dodge City, those big restaurants, Ruby Tuesday, it's the same thing as the school cafeterias. We're in there 3 times a year with that annual educational visit as well. There are some other establishments. It's just based on what kind of food and what kind of processes are going on. They could be anywhere from 2 times a year to 3.
Okay. And I know the tattoo weekend thing's coming up, but
Yeah.
do all those artists have to pay a fee?
They do.
For your
Yeah.
inspection?
Yeah,
Okay.
They do. They pay a fee to the department. It's all put on, you've probably seen it driving down 321, but Dragon's Den Tattoo Company. It's ran by this gentleman named Chris Hollifield, and he's the one that organizes the whole event. So he'll collect all the payments from all the artists he's bringing in, and then he'll come and pay us all at once.
Yeah.
And he'll have all of their applications ready for us.
We have a great relationship with our tattoo artists in the
Yeah.
county. My very first day of work with Logan was the tattoo festival last year. And so it's been fun that that's, coming up for another year. But Chris is great, and the rest of those guys are fantastic, and they're always on top of everything. And we're fortunate to have the relationship with them that we do.
Yes, sir.
Yep, and, of course, any complaints, we'll handle those as well. So all those lovely Facebook posts that we get, we're definitely the first ones on the scene as soon as those come out. Because I know Anna loves to shoot me text messages all the time. Hey, did you see this? Or, hey, have you checked this place out? And most of the time it's, oh, yes, I've already gotten several phone calls about it already. So people don't waste any time. Yes, sir.
Has the recent Boar's Head contamination with Listeria caused any problems in any of our restaurants or any of the eating establishments in the community?
So thankfully, I went out there last Friday as soon as I heard the news broke. And basically, everybody had already taken care of it. Boar's Head was already on the scene, and they had already taken all the products that may have been affected. So the response was very timely on their end, which was fantastic.
Thank you. Appreciate you being on top of it.
And I did want to mention too, I know I probably bug them a lot about different things, questions and stuff like that, but they're also great to jump in. So if we had an outbreak or something going on, they're like, where's it at? What can I do to help? We had a couple outbreaks at a daycare in Logan. Jake was out there helping, going over just some education and figuring out what they can do. And then also on our health department app, we have that portal. So the old, I guess the old portal that we had, it went to the new one, but luckily we're able to capture more inspections, and it's honestly a better system, but it has been updated with the current portal.
Yeah, so previously we had DHD as an inspection software, and last year the county graciously allowed me to make the switch over to CDP, which is a fantastic program, and it's really helped us be more organized and help plan out our inspections better. And it's just overall been a great program to work with. And they have a very sophisticated portal that, it's pretty user-friendly. So I don't think anyone would have any trouble using it. And they can pretty much look up anything you want on there.
Very well. That's been years in the making. I know we've talked about that for years.
Yeah.
So I'm glad to see that it's up and running. Well, we thank
Yeah.
you for coming tonight.
Yes, thank y'all so much. I
And
appreciate your
report.
time.
Anybody else have anything? Or-
Thank you. Yeah.
Thank you.
All right, thank y'all so much.
Thank you. Dan. Next is immunization report, Chelsea Parnell. And you'll have our flu shots at the next meeting.
Hopefully, it's not
That'll be-
October.
Yeah.
It should be in September, but there's always could be delays on
I think
shipping. Never
we
know.
won't have a meeting in September, will we?
Oh, is the next meeting October?
Yeah.
Yeah.
I haven't even looked at the schedule.
It's October.
Yeah.
You can, I don't know.
So we're just getting you ready
I'll
so
come
we can get our flu
anytime.
shots.
I stab people. I will definitely come, for sure. So like Anna mentioned, we had our immunization fair Tuesday. We had about 55 kids come through. Mainly wanted, the book bags and the WIC was there, Smart Start, the books, and so it was a good turnout. But only about 10 received vaccines for about a total of 30 shots given. But our motto is if it's one vaccine given, that's one less than when school starts. So we're hoping we were getting the rush at school's time, time to get kicked out because you don't have your vaccines. So there'll still be a rush. It happens every year because required vaccines for kindergartners, 7th grade, and 12th grade. So no matter how many times we say it, they'll still come the 30th day of the school year. This year we're reaching out a little bit more, trying to do more flu on-site clinics for like businesses. We've reached out with Ashley Bullock. She sent out some to her businesses that she deals with, and they've already just come flooding into my email asking the process of how to schedule. And so currently I have about 10 already scheduled and more waiting to talk to other people like when to schedule with their businesses. So that's exciting. I like to get out and go to these places and help. Mine's not as elaborate as that. That's about all I have. But yes, we'll do your flu shots October.
Sounds good.
I will bring them. And we usually go to Dr. McBurney's office on Halloween. So do a COVID vaccine. So
See what I can come up with this year.
yep. So that's always. So I guess that's 11. So that's always scheduled. So yes, sir.
I went to one of our local pharmacies about 10 days ago, and because I'm going to be traveling, pardon me, and I wanted to get my COVID shot. They told me they weren't giving them because it was found to be ineffective. Is that true?
We're still administering. Some of them, I don't know about, we've had several calls saying that they went to pharmacies and theirs have expired. So I don't know if that's
I was told that it was not effective.
that's not what we've heard. So we've
So
had
if I
several
come
calls.
out to the health department, I can get a
Well, if it's
COVID
expired,
shot.
it may not be effective.
Yeah. Yeah, well, that's true. There you go.
And I was on the state site this morning whenever I was doing my COVID message, and it said, make sure you get your COVID vaccine this fall with the flu vaccine, so they're still giving.
So
COVID
the
shots.
one that
They're-
they turned out in the spring is still available. I can get it at the health department,
now,
and
yeah.
and then when the new one rolls out in October, I can get that one.
As long as they'll always come out with a recommendation of timing from your last one, but it's
Right.
usually about 2 months. So
Okay.
as long as they still say the 2 month. But yeah, we have some in stock today.
I'll be out tomorrow.
Okay, I'll see you. It'll be me.
All right. Well, anybody else? Very well. Thank you.
Chelsea.
Next is an electronic medical record update or?
Yeah, it's an update. We're still in limbo with signing the contracts and stuff like that, but we did get approved for the grant from CCPN for $20,000 now and then $6,000 per examiner when we go live. And that will come to us to use as we see fit. It doesn't really pay for the implementation, but any supplies and staffing that we need. And they've worked really hard to give us discounts because we are a CCPN practice. And there's some issues with, if it's going to work with state reporting and stuff like that. But we're working through those, and that's to be expected. And so we're looking at possibly 1st of September having at least everything signed and ready to go. There's a couple of counties in the state that are in the implementation phase now. One big county has already gone through it. Dr. McBurney was so nice to come and give us a great training and show us all the good stuff and the ins and outs of everything, and got us all really excited about changing to something that's proactive and will help us do even better for our patients. So everybody's excited, but just kind of antsy to get started.
Yeah.
So,
Okay.
any questions or anything about that? It's just we'll let you know next time we meet in October where we're at in the process. Hopefully by the first of the year we'll be live. So, but we'll see.
All right.
That's the plan.
Okay.
Thank you.
Thank you, Levy. And then we're looking at our organizational chart. I think Anna's got that part of it as well.
So you should have a copy of the updated organizational chart in your packet. Just a couple of changes I wanted to bring to your attention. There's a couple of departments that I've moved around, like the dentist is now directly under myself, and I moved the finance team underneath the admin officer, Libby. But two things I want to bring to your attention is on the far left where it says DON PHN Director 3. That was previously Assistant Health Director. So that's changed to a Director of Nursing. And then under Admin Officer 2 on the far right, the second one down from the bottom where it says Accounts Receivable Specialist, we're in the middle of making this change to Accounting Clerk Supervisor 5. And the reason being is we needed to make this title really what this person does. Before we made a reclass and did what we needed to, but the title honestly did not get changed. So this person is still a supervisor. We just did not change the title part. So those are the two really important changes with our updated chart.
All right. Anybody have any questions about those updates or? Okay. That doesn't require any action. It was just information for us.
Correct.
And you have that as your organizational chart in case anybody in the public stopped and asked you, who's under who?
I have to know that?
Hey, just call me.
Does that meet the span of
That's what'll
control?
happen.
Yeah.
All right. Well, that brings us to the end of our agenda this evening, unless anyone has any comment or something you'd like to say. And if not, I'll entertain a motion that we adjourn.
Motion we adjourn.
I second it.
All in favor, say aye.
Aye.
Aye. We are adjourned. Thank you again for being here.